Are you getting me all? Should I go ahead? Please say yes. Okay, great. The first thing that I'm going to talk about. Oh. Let us first see psychosis. Okay, we'll go to Sora later, but first see psychosis. Maybe I can send this slide to you all if anybody wants. I will send it to Dr. Mamta. She can send it to you so that you don't have to write it down things. You just watch what I'm trying to show you. Don't get into taking photographs, and don't get distracted. Please don't get distracted. I will send you all the PPTs because it is not my original. It is cut and copy paste from Hahneman's Chronic Disease. So relax, okay, relax and just listen what I am trying to say. So now, what about psychosis? Psychosis. How do we understand what is psychosis? When do we give psychosis? So let us see what Hahnemann says. Let us first go to the some history of it. Okay. Psychosis in men means gonorrhea. So what are the symptoms of gonorrhea when a man gets affected by gonorrhea? What are the symptoms? Greenish, yellowish, whitish discharge from penis. Burning when urinating. Burning in the throat. Painful or swollen testicle. Swollen glands in the throat. So these are certain manifestations of gonorrhea. You know what Hahnemann actually did? He went back and he found out, like suppose he found out gonorrhea was one of the things which was suppressed. He went and found out what are the symptoms of gonorrhea. So gonorrhea symptoms are suppressed, but the virulence remains because it works on a dynamic plane. And these are the symptoms which get passes from generation after generation. So now look at this slide and you tell me what are the kind of discharges that you'll find in gonorrhea patients, maybe psychosis, which are the organ affinity that you can see. Yeah, genitals. Very good, very good. So first organs, if you see, genitourinary organ. So remember this. So genitals and the urinary organ, whenever it is affected, psychosis could be one of the big thing in that patient. Another thing is throat, generally throat, and the discharges. What about the discharges? What kind of discharges? Yellowish and whitish discharges. So a patient who has got recurrence of throat affection, lot of discharges coming down, or patient comes with lot of genitourinary trouble, psychosis could be one of the things. Sexual symptoms, psychosis could be one of the things. Let me go to the next slide. Now gonorrhea symptoms in women. Let us see what is written here. Greenish, yellowish, whitish discharge from vagina. Lower abdomen and pelvic pain. Now when you say lower abdomen and pelvic pain, what do you mean by that? Lower abdomen means if a lady, PID, yeah, somebody said very nicely. That's what I was trying to say. Pelvic inflammatory disease. So a lady comes to you and she says, I've got lower abdomen problem. The first thing you suspect is that some problem with the uterus or the ovaries. So again, you see, gonads, sexual organs affected. Again, burning while urinating. Burning while urinating. Again, which organ is affected? So you can see genitourinary. Even in men, genitourinary. Female, genitourinary. That's it. This is what you have to remember in psychosis. I'm going to make your life very simple. Conjunctivitis. The red and itchy eyes, maybe. Why conjunctivitis? Can somebody say why conjunctivitis could be in gonorrhea of women? Or conjunctivitis could be a part of children's? Can somebody say that? Yeah, birth. Very good, Dr. Rachana. Very good, very good. Birth. When this part is affected, suppose a lady is psychosis, is she full-blown psychosis, and the child is there, he's been going through the birth canal, he is passing the entire psychosis. That's why many a times it is said that when a child is born and he has got some blastoma, some tumors, eyes, brain, maybe especially eyes, you think of psychosis, maybe medorinum, thuja. These are the remedies that you will need in those kinds of cases. And we were thinking, oh, it's a tumor, so it's psychosis. No, 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 no. You will have to go back and look at mother. What was mother suffering from? That's why when we see children cases, right, we don't just jump on the totality. We go back and look what mother suffered, what father suffered. I'm going to come back to that part also. Bleeding between periods. You might be getting a lot of patients coming to you. They just come and say, doctor, I just keep getting these bloody discharges. It's not bothering, but it keeps coming in between the periods. Can you do something? No, not metrorrhagia. It is just like, little bleeding starts happening between the periods. And then we give our medicines, we give our mother tinctures, we give our totality, whatever, but nothing is happening. Intermenstrual bleeding. Yeah. So you have given your totality remedy, but the female is coming and saying all the way that my bleeding is not stopping, my bleeding is not stopping. It is not bothering, but it keeps coming. Maybe after 15 days, 20 days, 10 days in between. You need to start thinking maybe psychosis is one of the things. So I need antipsychotic remedy here as an intercurrent. Spotting after intercourse. Again, now you can understand the connection of it. Swelling of vulva, vulvitis. There it was testicles. So you can see again how it is being correlated. All the sexual organs. Burning in throat. Again burning. So throat, but then burning. So patient comes with a lot of burning. Maybe psychosis could be one of the things. Swollen glands in throat. You get tonsils, you get the lymph node swollen. It remains all the time. It's not going with the remedy. Maybe psychosis is the thing. So now these symptoms, what you need to do is that you need to keep it with you. And whenever you are stuck up in your case, or you see this phenomena coming up, right? Again and again, maybe psychosis, maybe antipsychotic remedy is needed in your case. Is that simple with all of you? Say yes or no. Till now? Okay, let's go ahead. Gonorrhea features noted by Hahneman. Now let's go back to other features other than this. So what are the features till now? Let's revise, recap. Genitourinary organ. Discharges, greenish, whitish, mucus discharge. Burning, gonads, sexual organs, glands swollen. These are the manifestations of psychosis. Good. Other features that came up and he understood is affections of joints and heart wall. Rheumatoid diseases, Rheumatic heart diseases, that could be one of the features of psychosis. You will find that you get some patients where uh, you will see in the past histories, in the family histories, not many people are suffering from joint complaints. The patient comes and says, oh doctor, it is in my family heritage, everybody suffers from joint complaints. Think, why is it? The symptom is transferred from one generation to another. Maybe probability is that gonorrhea, or she is a carrier of psychosis. Your antipsychotic remedy is needed. Fig warts, coliferol warts, of course, I'm not going to talk about this, because if we see warts, we just say, oh, this is psychosis. Definitely. That's it. That's in toto the feature of psychosis. Of course, there are more things, but you have to read the book then. But in fact, even if these things you can understand in totality, you will be always able to understand that this patient is suffering from gonorrhea, she's a carrier of psychosis, and psychosis is the miasm which is being hindering it, or it is working like a block. Okay. Now what happens, why we are studying this, why are we studying this? The reason is that when the miasm is very past history, or maybe especially it comes from hereditary generally, and when it is full blown, your totality of remedies are not going to work properly. You will see a lot of blockages coming in your life, in your patients. The patient is better and then suddenly he stops getting better. That is a time when you need antipsychotic remedies. So before I go there, let me show you something. Let me just discuss a case. Of course, it's a video call, so online session is going on, so I cannot show you a live video. I have not been able to mask the face, but I can narrate a case maybe, and I'll show you the reference. I'm having one patient right now. She is having an adrenal tumor. She has got adrenal tumor, and since 3-4 years we have been treating her. She has got adrenal tumor. She's got uterine fibroid. Okay, these are the things, and she's quite stable. We have really been able to tackle her and make her stable. Everything is okay. Suddenly, she called me one day and she started saying that I am getting a lot of pain in my lower abdomen. So I gave Macphos, I gave some other remedy, I don't remember, but nothing was working. I gave her indicated remedy, nothing was working. And I was not able to find the totality. She was just saying it is paining, the lower abdomen is paining, paining, paining. I cannot bear, please do something, please do something, please do something. And then I remembered, oh, she has got uterine fibroid. She's got uterine fibroid, big fibroid. And she's always talking about the lower abdomen pain. And then I gave one remedy. The remedy's name is Medorinum. I gave Medorinum 1m and then later 10m. With Medorinum 1m and 10m, also she was having a lot of metrorrhagia. So all these pictures came in my mind and I was not able to get the totality or get some characteristic. I gave Medorinum based on the understanding of psychosis. And after giving Medorinum, you will not believe the entire pain went off. The case where it was stuck for a while, 6-8 months, it started moving. And you will see many times when you give the right miasmatic remedy, the patient start coming up with the newer symptoms. It actually opens the door. I don't know if any miasmatic remedy will cure the patient. I don't know. But when you give an anti-miasmatic remedy, right one, the symptoms settle down and then the new symptoms start coming up. Maybe it starts indicating the next remedy. So miasm sometimes opens the block. So let me show you what is written in Medorinum before I move on to something else. Let us open Alan's keynote. Maybe I must have shown this in my lecture somehow. Let us see. I just want you to read this thing. For the woman. It's not showing. Okay. Maybe I'll have to share it again. Can you see Alan's keynote right now? Yeah. So if you see here, this paragraph, I want you to study. For women. Now look at here what he has written. This is not, Alan is not writing about miasms. He is writing about the drug. Okay. See what he writes. Ovaritis, salpingitis, cellulitis, pelvic cellulitis, fibroids, cysts, and morbid growths of uterus and ovaries. Entire drug picture matches, isn't it? And that is a psychosis actually. So meduranum is one of the remedies. I'm just giving you some clinical hints. The females that come to you, you get stuck up somewhere. Maybe meduranum can really be a big help for you to remove those blocks. Let me go back. Yeah, somebody said, yeah, I have mentioned in my maternal medical lecture. So let me go back again to the miasm part. Great. Can you repeat again? I was just showing you that meduranum, if you read in meduranum, he writes ovaritis, salpingitis, fibroids, uterus, means he's trying to say that that's the sphere of action of meduranum. And that's what I'm saying about psychosis. And meduranum is a psychotic remedy in a way. That's how I am trying to connect it. So I hope psychosis is clear with you all. No problem with that. Right? Simple? Is it simple? I will really go very slowly. Don't worry. But is it simple now to understand psychosis? Okay. Now anywhere you saw the word growth, outgrowth, anywhere you saw it, excess, accumulation, anywhere you saw it? No, because it is not written in Allen's miasm or Hahneman's chronic disease. So you know what actually Hahnemann did? Hahnemann went back and he traced out the picture of the disease, all the symptomatologies. And then he said, if the virulence remains and it passes to the next generation, these are the areas, these are the sphere of action, these are the symptoms that you're going to see in the patients. And he advocates that that's how you need to read the miasms, the intercurrents. In fact, today we are going to, I will also give you some hints about the other understanding, how to extend this in today's world. Let's go to